again, I'm Julian. I was first diagnosed in 2022, so just a little over 2 years ago. My melanoma was here in my scalp. My mom actually cuts hair for a living, so one day I said, "Hey, mom, there's a weird bump there. What do you know?" And she had her melanoma in the late '90s, and so she said, "I want to get that looked at." And then a few weeks later, I got the phone call. From there, it was kind of a pretty fast journey. I had my initial surgery to remove everything. Everything was good for the lymph node biopsies. So I was diagnosed with stage 3B at that point. And then a few weeks later, I had another surgery to kind of close things up. And then I started immunotherapy and Pembro. It was pretty quick. I think it was 2 weeks after that. And I finished that last August. And I'm very fortunate to say that everything was very routine. No side effects. Everything went, very well for me. And I'm very blessed how things turned out.
Julian had what we call adjuvant treatment therapy, so preventative therapy for 1 year. And now he's on surveillance, and you had 3 months or 4 months?
4 months.
4 months. So the first year is every 3 months, and then we go to every 4 months for a year, and then 6 months. So he's slowly getting there. So,
Yeah.
Do you have anything to add? Okay. How did you do with the Pembro?
For me, I going into it, I've heard, from absolutely nothing to obviously, the worst. I felt great. Between my wife, my dad would come on those visits. We kind of what made it more, I don't want to say enjoyable, but for lack of a better term, was kind of made an afternoon of it. We come in, we had the treatment, and then, we would go out to dinner afterwards or something, a little bit less, clinical, to kind of make the experience go around. I'm also a band teacher, and my students, they surprised me. They made wristbands that said "I stand with Savage" with a little music stand on it. They built those at school. I walked in one day to rehearsal, and they all had their bands on, so that was nice. That kind of, made the whole treatment process go, a little more smooth. Have their support.
Thank you. Go ahead.
Me?
Yeah.
Okay.
We can ask. This is informal. Okay, if you guys want to shout out anything at them or ask them anything, go ahead. They volunteer to sit up there, so they know they can get all the questions.
My name's Thomas Lomas, and in 2016, I was diagnosed with stage 4 liver cancer. Now that's a little different.
Melanoma to the liver.
Melanoma to the liver.
Yes.
Stage 4 liver cancer. And I came to the James because where I'm from, I would probably be dead because of that hospital. I'm not going to go into that, but I came to the James, Dr. Roger Newell. I was scared to death. When you hear that word, you got cancer. And I can still remember the day, March 9th of 2016, just changes your world. And I came over here, Roger Newell, God bless him. He said, "We're going to do this. We're going to do this. We're going to do this. We're going to help you." He made me feel so much better, so much at ease, at peace with myself. And I came in here and I got chemotherapy at first, lost all my hair. I was sick as a dog. I was on morphine. I was on oxycodone. I just was such in bad shape. But I had chemotherapy, lost all my hair. I was doing well at first, and then I went in anaphylactic shock. So they took me off of the chemotherapy for about, I'd say 6 weeks or so, let my body sort of readjust. Then they started me on Nevo. I accepted the Nevo and I just took off with it. I've had over 70 infusions.
Wow.
And my last treatment was in 2020. And I've been okay ever since. I come back from my CT scans, my blood work. And now, like the foreman said, I'm at 6 months now. I won't be going back for any kind of blood work or any kind of CT scans until 6 months. That'll be in February. And this is my rock right here.
Yeah.
She was with me the whole time, and I have to say something special about her. During 2016, it was a very terrible year for us. She lost her mother in February. I got diagnosed in March. She was diagnosed with breast cancer in September. And then her brother was diagnosed with prostate cancer in December. So it was really rough, but she's so strong. And when I got better, I was able to look after her and take care of her. So we've just been a team through all this. And I'm gonna say to everybody, if you ever have anything devastating like cancer in your life, this is the first class, world-class facility. You need to put your care in and your faith in, because these people will take care of you, their families. They absolutely will take care of you. And another thing, I reached out to God in my calamity. And I got down to 148 pounds. And I looked in the mirror and I looked like a walking skeleton. And I asked God, I said, Lord, if it's my time, you take me. But if it's not, you show me a purpose when I'm still here for you. I was more worried about her, my family members grieving over me than my own life at the time. I said, comfort them. If you take me, fine, I will accept that. But you know what? I'm still here. You know, and I'm so grateful. We only have one life to live. Try to live the best you can. Do the best you can. Surround yourself with beautiful people that care about you and love you. You know, but more than that, put your faith in God. And I always had a question. Why am I here? I still don't know why I'm here, but I was talking to a neighbor of hers one day, and he says, I know why you're here. I looked at him, I was perplexed. I says, why? Why is that? He says, you're here to take care of her, and she's here to take care of you. And that's the way it's been. You know, and like I said, everybody has been a family since we've been over here. Like I said, if you ever have to have any kind of treatment, care, this is the first class, world-class place to be. It's almost like a family here. There is negativity in learning that you have cancer, but also there's positivity that comes out of it. Because we have been surrounded by so many beautiful people and caring people. And that's how I feel about it. Yeah.
You're also here to share your story.
Oh,
with us.
absolutely.
So thank you.
Thank you.
Anyway, it's also what? Nevo is.
Optivo.
Optivo?
Yes.
Okay.
Yes.
Yeah. I'm sorry, we use a lot of generic names. So yeah, you had every single one of our
Yeah.
treatment that we ever had. So, but
I forget all the.
yeah, Opdivo is nivolumab and Yervoy is ipilimumab. And then we have Pembro is Keytruda. And then we have combination drugs together, the Ipi-Nivo. And then the Opdualag is nivolumab and relatlimab.
Can I ask a question?
Yes,
I noticed that Dr. Wu said till now. Well, I hadn't heard of that, so.
that's new.
That's great.
That's just got FDA approved February,
Yeah.
February of this year.
2024.
Yeah.
Okay, now, is that just for melanoma or does it treat like my symptoms, what I have gone through?
No, you had melanoma. It's just
It
metastasis
just
to the
went to my
liver.
liver.
Yeah.
Okay.
Yeah. Your diagnosis melanoma.
It's still the melanoma.
Yeah.
Okay, I understand.
And they're in the process of trying to use that in other cancer, study in other cancer. Right now it's
Clinical
FDA.
trial for lung cancer, for cervical cancer, for head and neck cancer. That's probably the other type of cancer that's being investigated with TIL.
So just to give you guys a history, prior to immunotherapy, which was 2016.
Well, 2011 was when the
2011.
first immune checkpoint therapy got approved.
Got approved, okay. So prior to the first immunotherapy, which was nivolumab, ipilimumab,
First one was IPI.
Yeah. and that was 2011. Prior to that, all we had was high dose interleukin-2, which you went through. And then we had interferon and
The
chemotherapy.
Chemo and radiation.
Chemo and radiation, and then immunotherapy came, and that was 2011. Now, 13 years later, now we have TIL. That's the next step. So, and we're trying to do more, and there's more other stuff with vaccinations and combination drugs and so forth. Bob, you up? You got every single drug we got.
My little
Except
journey started in my ankle with a mole discovered by my friend doctor I grew up with. I was just getting a physical. And he saw it, didn't like it, so
It was black.
And, I never paid any attention to it. So anyway, they cut a little bit of that out and found out it was melanoma. Then they cut more out and, I was okay for almost 5 years. And a little lump, popped up in the back of my knee and was pretty aggressive. And they removed that.
Well, that's,
Well,
then he
like-
came to us.
Yeah, then I came to SU. And then in '09, and they removed that and it grew right back like super fast. And then she removed it again. And my lymph nodes and my groin. And it came right back, didn't it, after that?
Well,
I'm trying to remember.
it
But,
kept coming and
It
going,
was pretty aggressive.
but let's see.
Then I ended up,
You did surgery, interferon,
oh,
Oh, you want to tell a little bit about interferon? 'Cause
Oh,
we
that's
don't use
awful.
that anymore.
IL-2.
I did everything you guys came up with,
Including immunotherapy.
but it ended up going to, like Dr. Katar's talked about, was getting
Katar.
limb perfusion in Buffalo, because they didn't do them here at the time, a perfusion. And this thing was the size of a grape, like a head of cauliflower. And, I went up there and had that done, and it just melted away. Like in the shower every day, more would fall off. And so that was a great thing, at the time. But then it, ended up traveling in other areas and, just over to just in many places, my shoulder. And so, yeah, just all over, basically over time, but we just kept trying everything they would come up with, doctors, and you just try and stay ahead of the game a little bit. if
Did you
can.
get radiation too?
Yeah,
Did you get radiation
Yeah.
there?
my shoulder and I think my leg.
He had every treatment available here at OSU.
Yeah.
And a lot of times a treatment was not a once and done. Now, the IL-2 was a once and done.
That
Never
was
did
rough.
that again.
That was rough.
But radiation, we bounced between radiation and a treatment. And then once he progressed to the immune therapy drugs, he tried them all.
Yeah, he
That
went
was
from
available
single
in
agent, double
combination,
agent.
And
yeah.
combination of Opdivo and Yervoy,
Mhm.
2 different times, because he had blood in his urine and his kidney was doing something. And so he did, I think, 4 treatments of that, which took care of that, but then he just took it later towards the last parts of his treatment here. And then he
But
didn't
it's-
tolerate that very well. He ended up in the hospital. So,
But it's amazing, all that can transforms from a little mole on your leg. It's mind-boggling.
So what's some of your residual side effects from all the treatment you went through?
The radiation, I think, is my right hand is all numb, my left foot's all numb. So and it was all delayed. My left foot's numb now, but it's been 5 years since over 5 years before that started to happen. But my arm was probably a year after I had radiation in my shoulder. And then you have the,
Lymphedema.
removing your lymph nodes. That's a little troublesome, but
Where are you at on your surveillance? How frequent are we seeing?
okay, I think.
How frequent are we seeing?
Is it every 3 months, 3 or 4 months, I think.
I think at one point I thought we went up to 6
Yeah,
and
yeah,
then we
we
had to
did.
go back.
Well, then I got that infection. I got outside of that, I got a septic infection that really rocked my world, but, I think we were out 6 months.
Yeah, so even though we have a timeline of how frequent we follow a patient after they're complete, but things can move, depending on what we find, what's going on, and it can go backward. John, go ahead.
Oh.
I'm sorry.
Go ahead.
Yeah, Robert, how long ago did you have the IL-2? I went through that years ago.
It's
I was just curious.
over 10 years ago, probably.
It was-
That was a
They were
rough
still
deal.
offering it then.
It was before April of
It was
two thousand and ten, so it's
Yeah.
probably in 2009.
That was a rough deal
Yeah.
for me.
Yeah.
I mean,
I had it way back in 2006.
Yeah.
We had that for like 20 years.
Yeah.
Just IL-2 was the only thing. And once immunotherapy came out in 2011, we use it less and less.
Right.
Stuff, so.
yeah.
And so you remember the edema, the swelling, and some patient get a little bit crazy in the hospital.
Going-
That's all the medication, but they reversed. Cindy,
I'm
what,
just curious about what place nodular melanoma plays in the whole process. Does it affect?
nodular is just the side, the presentation of the tumor.
Okay, so it doesn't affect treatment
No,
or?
no, it just, you can either acral lentiginous is your nail beds, your nails, your toes and so forth. Mucosa is like in your mouth, vaginal area, ocular is eye. Skin is cutaneous, but those skin nodules could be, lesion could be a nodular. Nodular is just a term, am I correct? It doesn't play in.
So melanoma can either grow horizontally or vertically.
Mhm.
The ones that grow vertically, we call them the nodular melanoma, and those have a higher risk of going to your lymph nodes.
Yeah, because
Because
they're
when they go
bigger,
horizontally,
they're more
They're not
round.
less likely to do that, but when they go vertically, they don't need to go very far before they can get this.
Yeah.
Thank you.
Yeah, it doesn't change what the therapy is. The only difference is if you have ocular or eye melanoma, the therapy right now, the only FDA approved is Tebentafusp. Whereas cutaneous melanoma, we have a lot more option because we do a lot more research on that. Mucosal, we're using the same as cutaneous melanoma. I don't know if their research available right now in mucosal, that because it's the number of patient is a little bit smaller. So, but they use the same as cutaneous of skin. Yes, Dr. Steve.
Also, I think that hepatic perfusion was also recently approved as
Yes.
well.
Yeah, that is also the recent one. So if we had that hepatic perfusion available when you first got diagnosed with metastatic to the liver, it probably would have been one of your options.
But it's limited centers currently can do that.
Yeah, we had clinical trial here that started that, and now I think we are able to do that now. Dr. Contreras is also does the hepatic perfusion. All right, Tara. This is,
Can I say something before you move on?
yes, please.
I would like to thank everybody at Ohio State.
Yeah. Oh, yeah.
Bob has been a patient for so long. His previous oncologists were Dr. Owinki, Dr. Shaw, and currently Dr. Wu. You've been with him since day one.
Boom's the hardest working gal.
Everybody over at the Morehouse on the fourth floor, the lab people, the infusion people, everybody. And what I like about is, I'm gonna talk about you specifically, Dr. Wu, but it was true of everybody, is you're always thinking about the next step. You know, if we have to go somewhere from here, what are our options and where we can go? So I always left feeling like it wasn't the end of the world.
Right.
And I appreciate that. So I appreciate everybody that's.
Absolutely.
We do
Feel
have
part
hope
of
in
his hair.
cancer. The word cancer doesn't mean death anymore. I mean,
Mhm.
there is hope. We do have
Yes.
treatments. We do have researchers available as well. Anything else before Tara get up here? Because once she gets up here, she's gonna take over. Go ahead, Tara. You want a mic?
I did bring my laptop. I'm just moving over here because if I'm sitting over there, I can't see everybody, no pun intended. So, I mean, obviously we have a lot of patients in here, and first I would like to say that my story is probably nothing compared to some of these stories up here. See, I told you I don't take over, I get emotional. But my story started in the year 2000, and I was in Ireland playing soccer, and I was living the dream. I was 22 years old and I could do everything and anything I wanted with nobody finding out because I was overseas, right? And I was diagnosed on my right thigh. And if you think about what that is, I was a soccer player, so I had shin guards to here and shorts to here. I played soccer in college in Atlanta where the sun was bright and shining and strong every day, and then moved over there. I went into the hospital with some pains in my back, thinking I had a kidney infection. And I had a medical intern in the ER see the spot on my leg and was like, that doesn't look right. Let's do a biopsy. So 5 days later, I went back to the hospital to get the results, and it was positive for melanoma. And I was living over there by myself, 22 years old. And I called my mom and I told my mom, and my mom's a surgical nurse. So she was like, "Oh, this is serious." And I'm like, "I'm 22 years old. I can conquer the world. This ain't serious. I'm not coming home. I'm staying here." And she's like, "I think you should probably get on a plane to come home." And I'm like, "I'm showing you I'm not coming home." So when I stayed there, I had a skin graft, and that was skin graft number 1. And they did the centennial node biopsy, and that was positive. So then that graft didn't take, and then I had another skin graft, and that graft didn't take. So then on skin graft number 3, finally that took. So we used to joke that it looked like I had a shark bite in my leg. That's what I used to tell all the kids because it was a much cooler story than cancer. But in that time, when this node was positive, then they went back and took more nodes, and those were positive. And so I did 6 months of treatment over there. And when I did 6 months of treatment, 3 months after I was done, it tracked up my leg. So from here to my groin, there was a tracking. And about that time, the doctor over there said, "I think it's time for you to go home and be around family." And my mom had already come over. She came over for 2 weeks to visit, and she's like, "You ready to come home?" I'm like, "I'm not coming home yet. I'm still staying here. I'm going back to playing soccer." And she was very trying to convince me, like, "Come home, come home. Come home with me. Come home with me." I'm like, "No." And this was during the surgery time. And so meanwhile, she's over here working her magic back in North Carolina where she lived, like making sure she's already connecting with doctors. So after that 6 months of treatment, and it tracked up my leg, and the doctor said, "I think it's time for you to go home and be by your family." My mom had already had appointments set up for me at Wake Forest. And so, oh wait, do have to tell this story. I didn't care about anything other than living that first time. I snuck out of the hospital. My mom came over to visit. I'm in a wheelchair with an IV pole behind me and a morphine drip, and I snuck out of the hospital. I don't know how you sneak out of the hospital with an IV pole and morphine drip, but I did it. And she's a nurse, and she's driving me in my wheelchair, and I went over to the bar, and I was doing a shot. I was 22. I was 22, right? So at that time, it was all about living. If I'm gonna die, I'm gonna do it right. I'm gonna enjoy all my moments, because in my mind, when it was coming back, that could have been a possibility, because that was 2000. We didn't have the treatments we have today. So anyway, I snuck out of the hospital, and when I got back, the nurses were pretty upset with my mom, and my mom was like, "She has cancer. She's gonna do whatever she wants to do. If she wants to go to the bar, she can go to the bar." And so that's the kind of mindset I had back in my 20s. So I hadn't a care in the world. I was gonna beat everything, and I was gonna do whatever I wanted while I was beating it. Okay. And so I came back and I got isolated limb perfusion, not the infusion like Dr. Contreras talked about, but the perfusion. They had said, you know, here are all the things. It's 2001 now. These are all the things that you could happen. And I don't know about you guys, but when they tell you all of the things that could happen, you're like, whoa, I don't know if I'm ready for this. They're like, you may not walk the same, you may not do this the same. You're probably going to be tired. All those things can be scary when all the doctors are telling you all the things that might happen. So a week after surgery, when they said, well, we're not sure, you know, how you're good, if you're going to walk the same. I'm like, I'm going to show you, I'm going to go for a run. And so a week after surgery, I went out and ran a mile and then didn't get out of bed for 2 weeks. But I went and got to tell my doctor this is what I was gonna do. So anyway, I did. So now I have done interleukin. I have done limb perfusion, and then I did high dose IL-2. So interferon, limb perfusion, IL-2. And so high dose IL-2 for a month, every day for a month, and then 6 months of a low dose with 3 shots per week. 20 years cancer free after that. 20 years. Yeah, so 20 years cancer free after that. And I had like 2 weeks left of treatment when I found out I was pregnant with my daughter. And the cancer had already come back once, and the doctors was out Mount Carmel at first, my doctors for my daughter, my pregnancy, and they had presented me with, they thought maybe I should have a medical abortion because the cancer had already came back once, and I still hadn't completed quite my treatment. They don't know what that 2 weeks of that treatment could have done for my daughter, and I was like, nope, no way. Like I'll chance it. I won't get the treatment if I need to. God does everything for a reason, right? You know, everything for a reason. So my dad said to me, you should probably do that. You don't know if she's gonna come out with 3 fingers and 2 toes. What could you be doing to her? Because you had, you know, 2 weeks of treatment not knowing. And I was like, God does everything for a reason. There's no way I'm having an abortion. And I prayed to God that if I just made it till my daughter was 18 years old, and the cancer didn't come back, I would be a happy mom.
You have
Yeah.
a beautiful daughter.
Thank you. So I called her my miracle baby. And at 18 years old, 9 months after my daughter turned 18 years old, is when the cancer came back. And so, sorry.
Where did it come back?
What?
Where did it come back?
Came back on the my left side, right. And so we started treating that. We had surgery, those lymph nodes removed, and then we started Opdivo. And then 12 months into Opdivo, we started to see progression again to switch to Braftovi, Mektovi. But in that process, in February 8th of 2023, I was diagnosed with ocular melanoma. And so 2 separate, unrelated. It was not the melanoma that spread to my eye. It was a primary site. So within a little over a year, I had stage 4 subcutaneous melanoma and then diagnosed with the ocular melanoma. So the plan was plaque radiation. And I went home and I thought about it. I prayed about it. I did research about it, and I probably didn't sleep for a while. And I was going back to Dr. Sabula, and I was like, I think that enucleation is the right for me. Can we talk about it? I sent a message in my chart to the nurses. So we went back and we talked about it, and in my mind, I had been aggressive with all of the other things that I have done. And so in my mind, aggressive is what was going to help me save my life, and also to help me move forward, because I didn't want to go through eye treatments along the way after plaque radiation. I didn't want to do all of those things. I wanted to, if I was going to lose my vision, I was going to lose it on my terms, not on cancer's. I didn't want to gradually lose it. If I'm going to lose it, I'm going to lose it now, and I'm going to move on with my life, and I'm going to learn how to live monocular, and I'm going to move forward. So she was on board. So March 23rd, 2003, I had my eye removed. So 3 days after I had my eye removed, I'm like telling my husband. So my attitude has stayed similar, but I stopped going to sneaking out of the hospital. I did mature a little bit in my 40s. So now I am on. I did targeted therapy, and I handled that pretty well. And now I'm back on a Devo. So
Why are you back on?
so the progression in my lymph nodes. So when we went to Braftovi, Mektovi, I was on that for 9 months, and during that time it got smaller. It reduced in size, and at the 9-month time, it started to progress again. So when they said the average time for Braftovi, Mektovi is about a year, mine was 9 months before it started progressing again. So we went Opdivo, Braftovi, Mektovi, targeted therapy, now back to Opdivo. And that's where I am today. And the last my two scans have shrunk. I try to bring light to my story because I know we've had some heavy stories and we're all crying up here. But I bring light to my story because I like to share that there's sometimes we feel like there are things that are out of our control as a patient. And there's a lot of things that are in our control.
Yeah, don't give up.
There's a lot of things that are in our control. So I will show you.
We can plug your laptop in.
So they don't have to see it all. You can get the gist of what this is. But this was my symptom tracker that I had when I started my targeted therapy. And what I found was that 7 to 10 days after every treatment is when I saw a spike in my symptoms. So I knew when I got to that 7 to 10 day point that I had to be really consistent about what I'm eating, what I'm sleeping, all of the things that I'm doing. This is another tracker. So when I had my lymph nodes out, I had data that would say my activity. So I was tracking my activity and my drainage. And so based on my activity, what did my drainage do? So I knew what activity level I needed to be at. So this is my floater tracking. So if you can see when my floaters first started, there's trending upward. My floaters first started, there was a lot of people that were like, it's so rare, nothing to worry about, right? It's so rare, especially like you already have subcutaneous melanoma. Ocular melanoma is rare as it is, let alone to get it simultaneously within a year of subcutaneous melanoma. So I started tracking the duration and frequency of what my floaters were. So then I knew that's when it was time to go to the eye doctor, and that good thing I did, right? Because I was able to take care of that super early. This here is another graph, like my lymphedema. There's multiple graphs on top of each other, and I'm not saying I'm a behavior analyst. So
Not everybody can track everything. She does great with this.
I'm a behavior analyst, so I love data, but it was my way to know that there are things that I could do that made my life less difficult. So when I looked at this and I put all the graphs on top of each other and saw the trends, I watched the trends. And so when I was younger, I used to, when I'd get lymphedema in my legs, I need to sit down and I need to put my legs up because they're swelling, right? So everybody tells you when your legs are swelling, put your feet up. But lymphedema is different. What I had found with my lymphedema is that if I was anywhere 10,000 plus steps a day, that's when my swelling was the least. So my tracking, and you don't have to track it in a graph, but just writing stuff down and watching the patterns of what you do has drastically improved my quality of life. I was able to know when I needed to go to the eye doctor. I was able to know what I needed to do to reduce the drainage when my lymph nodes were removed. I was able to know and track the swelling in my legs and how to keep control of that. So I know my story is long, and it's probably still not half of everybody else's story that's up here. But the reason like I share so much is because as a patient, not very many patients take data like this. And through my own data tracking, not the like fancy words and all the things in the experiment. I'm a life expert in lymphedema. And so if there's anything you could take away is just knowing how much control you have as a patient. And knowing that when you get into a place where it's dark, finding the joy and connecting with people that you love, and knowing when to disconnect too. I don't know if anybody's a social media person, but you can get on some of those sites and it could be really sad. And so knowing when to connect, but also to disconnect, because I was on a melanoma site and it was like, so and so passed away. So and so passed away. So and so's cancer spread. A lot of times on there, you don't see all the positive stories. You see all the stories that are negative because people are reaching out to ask the negative piece. So just being aware of like when is a great time to connect with people and when is it a time to disconnect, because sometimes it's not the right connection, if that makes any sense. So anyway, I share all this to say is we have all been connected in a way that we probably don't want to be connected in, right? Like we'd love to say that we don't, but this is our chance, like you said, to have purpose, share our stories, help change somebody else's life. Also, I'm going to put a little plug in here. In April, I have a fundraiser called Cancer Killer, because I say I'm a cancer killer, not killed by cancer. And last year we raised $19,000. in Lancaster, Ohio, we have a place, you'll see flyers around the floor, and the money goes directly to Ohio State research. Like Dr. Contreras is leading some of that research. So the reason why I did this is because for one, it gave me purpose. But two, knowing the money comes directly back to the doctors that we've all been a part of working with. So if anybody, it's my kickoff to Melanoma May. It's the last Saturday in April. So if anybody wants to come, we'll be there. We have a lip sync battle.
I'll be there.
He was there last year, yup. And last year we had 170 people there. It was a great event, and I encourage anybody to come and hang out with us. All the doctors came as well. That was pretty cool. Dr. Wu has this spin when he dances that everybody must come and see.
Just so you guys don't know what lip syncing is, we came and we didn't know to prepare. They are professional. They
Yes.
came in outfits
Yes.
and imitate the singer exactly. We just went up there and danced.
And the doctors did
You guys-
Staying Alive.
We did. We
They did
resuscitated
Staying
her.
Alive. And I said, well, how about I go and pretend? And I went and laid down on the floor, and they brought me back to life.
Yeah, we did. We do have a video. And Tara right now is still on treatment, and she's doing very well right now. And when she went from Opdivo, which is nivolumab, to targeted therapy, which are pills, and then switch over to combination drugs. And then after completed 3 months of the combination drugs, she went back to Opdivo. That's the protocol. Now she's on the maintenance of the nivolumab of Opdivo.
Treatment number 6. Surgery, I think I'm on like 28 surgeries now.
You should, you should see the variety of prosthetic eyes she has.
Oh, yes.
Oh, so that was my other, so my other decision to not have a look-alike eye. I know Dr. Cipolla said you can get the eye that looks the same. So I used to work with behavioral students, and now I'm an assistant principal, but my message to students was that you need to be who you are. And my feeling was if I was going to be a one-eyed person, I was not going to cover it up with a fake looking a real looking prosthetic and look like a two-eyed person when I'm really a one-eyed person. And my first eye was gold. And the reason why I chose gold is because I used to tell my students that there's a gold nugget in every challenge that you face, and it's your job to find your gold nugget in every challenge that you face.
Well, can I say something?
Yeah, yeah.
Having been through everything that we went through, I need to tell you people, tell your loved one every day, you love them.
Yes.
Let them know there are purpose in your life. Let them know. Did you know how many people? One story that I laugh every time I think of him. He so scared of losing his hair. Okay.
Go ahead.
I'm out doing something in the car. I get the phone call from him. He's crying. And I said, I know what's wrong. He wouldn't take a shower for days because he's afraid his hair was gonna come out. And I said, I know what you did. And he said, how do you know? I said, because you took a shower, didn't you? And he says, yeah. And he says, it was coming down my face, down my back, through my fingers. And he says, are you still gonna love me? And I said, Jeff, I am not in this relationship for your hair.
Yeah.
And I think this is one thing that's helped us so much. We have always had a sense of humor. And we've always played off each other.
Yeah.
Yes.
And it has helped us, I think, so much. We happen to have a stupid little stuffed chicken that we blame everything on. It has something to do with it. And we dress it up, we do all kinds of stuff. People would think we're retarded. It's just a way to deal with something.
Mhm.
It really is. But like I said, tell them you love them every day and tell them that they're a purpose in your life and always will be. As long as they can be.
And as you can see, cancer is just not a one-person thing. We do need to have a community. We need the support from family members, from your team. Everybody has to help in with trying to eventually we'll get to cure cancer, I hope. Those smart physicians back there, they're the ones that's supposed to do that. But in the meantime, we do have new things to help us get through the cancer diagnosis every day. As you can see up here, we have stage 3 to stage 4, and everybody went through treatments and tolerating it and surviving, and that's what we're gonna continue. John, go ahead.
Yeah, I didn't know if you had all these people, you told them about minimum support. We had that, I just didn't know.
No, we started the symposium in 2012. And then at the same time, we also started a melanoma support group at that time. And we were meeting once a month. But then of course during COVID, we had to kind of shut everything down. We started back up the melanoma support group, but then at this point right now it's closed. So hopefully eventually we'll try to get that open again. But that's what we do during the support group, is have everybody tell their story, trying to learn from other people and learn about how they go through things and symptoms, side effects from therapy and stuff. So for right now,
Yeah, it's a positive.
it is a
So,
positive thing.
We're,
Yeah.
you know, we're too crazy to be negative.
That's true. That's true. It's always nice to have somebody else that go through that. And they understand, and then that way you can discuss things and help support through the other therapy.
And the group went from what, 2 people in a room?
Oh, we
to
started out
20.
in the closet. Literally in the closet.
Yeah, they
We
built up
went up
about
to 20 people.
Then
Yeah, unfortunately, I did get busy, so, but hopefully we'll get back to that. But for right now, we do have melanoma support group on MRF, the Melanoma Research Foundation, and the ocular team also have a support group on their website as well. So there are support group out there, but hopefully we'll get it in person again. Anybody have anything else?
Thank you all for
Thank you
sharing.
so much for sharing. And so I hope to see everybody here for next year on May 10th, and hopefully a lot more people. Okay, and please fill out your evaluation for us. Thank you so much.